back, everyone. My next guest has been on with me once before. I have Dr. James Adkins, and he is the CEO and founder of Escape Spine Surgery. Also, Arizona Pain Treatment Centers, excuse me. I want you to tell everybody first a little bit about yourself, but most importantly, what Escape Spine Surgery really means.
Yeah, thank you for having me back, Carol. Escape spine surgery is exactly what the name says, trying to help patients escape or prevent a spine surgery. The acronym ESCAPE, Endoscopic Spine Concierge Activation Program, but it's all about escaping a fusion, escaping a big surgery, and we're set up to help patients prevent those big interventions whenever possible.
Well, let's talk about that. You know, before you came on the show, I started to talk to you a little bit about people and how they think, right? And it used to be a long time ago that people either believed in certain things or not. And now everybody's reaching out for something to feel better, right? Because they're all sick and tired of being sick and tired and not feeling good. And they're looking for other alternatives. And you said, yeah, Carol, you know, it's really true. That has changed. You have owned these centers here in Arizona for how long?
Since 1997.
Since 1997. Yeah. You know pain pretty well. As a matter of fact, you really know it well because you yourself are a patient of what we're going to talk about.
Correct. I've had a herniated disc myself, and I recovered from that, and I've also had a torn labrum in my hip where I had to use my own bone marrow, my own stem cells to repair that, and it worked remarkably. We did that about 8 or 9 years ago. But you're correct. Patients are now asking and requesting from their physicians a more innovative approach, and sometimes we say the practice of spine medicine specifically is the patients are requesting more innovative procedures, sometimes even than the local physicians are doing. And we see a lot of international patients requesting these endoscopic surgeries we do, or these regenerative medicine procedures where we use a patient's own stem cells or own platelets to repair tissue. We see a lot of, there's a big interest in the community for that.
You also said that you have a plethora of doctors that are kind of specialists, right?
Yeah.
Explain that.
Yeah, so Escape Spine Surgery is a medical model, a medical home model where we have physical therapists and chiropractors in the community that are on the team, a spine surgeon that leads at Dr. Baig here locally, and our interventional pain physicians are quarterbacking the program. But patients, if they're going to be doing rehab exercises or getting repeat visits, it needs to be convenient. So we have some curated chiropractors and PTs in the community that we utilize for our team to help patients rehab when we're treating a complex spine or pain issue with our patients.
What we're going to do is we're going to open up the lines for everyone to get that you offer free MRIs.
Correct. So if you have a question, many times when a patient is getting injections or is potentially facing a spine surgery, they have questions. They want to know, is there an option? Can I prevent a fusion? Do I have to have this surgery? Do I need another steroid injection? Are there options for me? So if you have an MRI and you'd like us to take a look at it and give you some advice, we're happy to do that. We'll do a free MRI review.
So you can call in here. It's a review. So our number here is 602-277-5369, and toll free it's 1-866-536-1100. It's a review, and I want to explain that. A lot of people today get them, right? They get them because they're there. They paid for it.
An MRI?
Yeah, they paid for them, so they have them, and you can actually review them and then tell them, well, what does it look like? Let me ask you something. Somebody has had something a long time ago, right? Mm-hmm. And can you still help them?
Yeah, that's a good question. Most of our patients that come to us are not new injuries. They're people that have had these problems for years. Most of our patients have tried therapy, chiropractic treatment, medicine, injections before they get to us. We're trying to prevent them from having to have a more invasive surgery. We do those too, but we're trying to prevent those. So most of our patients have tried other procedures first, and if a patient's MRI is too old, our physicians will get a new one. We'll order a new one, but we can review those. You can upload them through our website at azptc.com or escapespinesurgery.com, and we can get a diagnostic quality look at that. Review that with our surgeons and our physicians.
Well, you want to check them out on the website. It's escapespinesurgery.com, and the phone number to call direct is 602 265-8800. And they're going to do a free MRI review for you, which I just love. With the situations like, let's say somebody needs regenerative medicine, I want them to understand the downtime of this, because from what I remember you saying, I don't think there's any.
Yeah. Regenerative medicine is a field of orthopedics and pain where we utilize your own cells. So we utilize your own cells to repair or replace tissue, and there's no chance of you having a problem with that because it's your own cells. You're not going to reject those, and the downtime from those procedures is very little. It's an injection. The patient usually takes the afternoon off and is back to doing their normal activities the next day.
When you had it done, how fast did you see the turnaround? And when you said to me, I can walk, I can do almost anything.
Yeah. So I had regenerative medicine where we pulled my own stem cells, my own bone marrow, aspirate, concentrate out of my hip, and then prepared that and injected it back into where I had torn labrum. And that was about 8 or 9 years ago. For 2 days, I was actually quite sore because it caused an inflammatory response in my hip. But after that, I was able to ambulate perfectly. I'm now, like I shared with you a while ago, I kite surf, I snowboard. I have no problems with my hip, and it was repaired by using my own cells.
You have several locations throughout the valley. 3 is for an exact number, and you can check them out on the website. I always think it's important to check them out because everybody loves to do that. You have been in this valley for 25 years. You yourself are a patient, right?
Yeah.
So you understand them. That's also really important as well.
Patients have questions, and having a physician that is willing to spend the time to answer your questions is important. We'll do that. Having options for treatment. If you see only a physical therapist, or only a chiropractor, or only an interventional doctor, or only a spine surgeon, sometimes those practitioners are only interested in their subject matter and aren't interested in another expert's opinion. So we have all those practitioners on one team. So you get a better, more objective feedback from those group of physicians as opposed to one specialist.
Check them out. It's escapespinesurgery.com. Their giveaway today is a free MRI review, and our number here is 602-277-5369, or you can also call them at 602-265-8800. I know that you try and help people escape spine surgery. That is what I think your main objective is. But sometimes it's required. Now, you mentioned last time endoscopic spine surgery.
Endoscopic
What
surgery.
is it?
Yeah, it's a small tube. Dr. Begg, our brilliant spine surgeon, Dr. Nasser, my partner, interventional pain physician, use a really tiny tube. It's 4 to 7 millimeters. If you think about the diameter of a dime, about the third of the size of the diameter of a dime. And they use a light source and a camera and a cutting device and operate through that tube. So it's an elegant solution versus having an open surgery or a fusion. It's a great option.
I love that. Elegant solution. See the way that doctors talk? It's really neat. But I think it's really important because so many people out there, especially, let's say they've had surgery, and they still have pain, because a lot of people do.
Mm-hmm.
Can you tell them? Can
Absolutely.
You still help them?
Yeah, they're having a fusion will oftentimes at a level above or below that create what we call adjacent level disease, and then a patient's looking at another surgery. Our physicians can go in with a tube and prevent that big revision oftentimes. So it's an elegant solution for patients having a pain post-surgically, and we can also help them with injections and medicine if they're having pain after surgery.
I think it first starts with a consultation, obviously, and if you have your MRIs, they can do a review for you. That number to call them direct is 602-265-8800. They have 3 locations here in the Valley. They have been around here for 25 years. This man knows pain better than anyone else because he also deals with it himself, and he has helped himself, and that's the other thing. You've walked in their shoes, so you know exactly what they're going through, and that's really nice. Check them out on the website. It is escapespinesurgery.com. Also, you can call them. They're going to do a free MRI review for you. It's 602-265-8800.
Thank you.